started now.
Thank you. Well, good morning, everybody, and welcome to our question and answer session on vaccinations for staff or managers that have got concerns or issues or any questions they have around the vaccination. This is a session where we've got some experts to answer some questions for you, but also to have a conversation with you about those real concerns that you have. This is about compassionate conversations. This is not about coercion to have the vaccine. So we'll start by introducing our panel if that's okay, and we'll go round in no particular order, but as it appears on my screen. So Janine, Dr. Janine Smurl, would you like to introduce yourself?
Yes, I'm Dr. Janine Smurl. I'm a GP in Norwich and I'm a clinical director for Norwich PCN, and we've been involved in vaccinations in Norwich. We've done about 180,000 so far, including going into most of our care homes as well.
Thank you, Janine, and lovely to have you with us again. Boyka.
Hello, I'm Boyka Vishal, consultant in public health. I'm also a doctor of medicine by background, and we've been supporting care homes throughout the pandemic. Nice to be here.
Thank you, Boyka. I think there may be just a little issue with your sound. I'm not quite sure, but might just need to fiddle with it, but hopefully it'll be okay, Boyka. Stephen.
Good morning all, my name is Stephen Long. I'm a Senior Quality Monitoring Officer for Norfolk County Council.
Thank you, Stephen. Suzanne.
Hello, I'm Suzanne Baldwin. I'm Assistant Director for Workforce, Markets and Brokerage. That's within Commissioning Adult Social Services at Norfolk County Council.
Thanks, Suzanne. And Kalu.
Hello, I'm Kalu. I'm the Integration and Partnership Manager for CCG and South Norfolk. I've been involved in the roving model in our communities and also working with BME for the vaccination.
Thank you, Kalu, and thank you for joining us at such short notice. Thank you. And I just wondered, do we have Kelly here at the moment? Has Kelly joined us? No, I don't think she has.
Nope, not at the moment.
Not at the moment. Okay, I think that's everybody. Just to explain, my name is Christine Footer. I'm the Chief Operating Officer of Norfolk and Suffolk Care Support. So we've been involved in providing information to the care sector around the vaccination rollout, but guidance and all things connected with social care. And Megan, did you want to introduce yourself?
Yeah, hi everyone. My name is Megan Durrant and I work as the Communications and Admin Executive, and I work for Norfolk and Suffolk Care Support, and I also work for NORCA, which is the Norfolk Care Association.
Thank you, Megan. Thank you. So we have had some questions submitted to us, which we will go through those first. And if, as I say, if there's any questions that aren't answered, that you want answered, then please pop them in the chat box at the end of the session, put your hand up and we'll come back to you. Okay, Megan, do you want to start with the first question?
Yep, the first question is, I'm an ethical vegan. Is the vaccine suitable?
Thank you, Megan. Is there anybody on the call that would like to answer that? Any one of our experts? If not, I can talk. I can certainly say what it says from the Vegetarian Society. I hope everybody is able to go to the Vegetarian Society and have a look at what they say. I'll just explain actually directly off the website for them what they say. So I'm just going to read directly from that, so please bear with me. Since all medications currently go through animal testing and animal products are commonly used in the manufacture, decisions around taking medication can be complex for vegans. However, it's been more important for us to talk about the definition of veganism in the context of medications, including vaccines. I'm just paraphrasing now because I'm going on to the part about COVID. In the case of COVID-19, vaccination will play a fundamental role in tackling the pandemic and saving lives. As there is currently a legal requirement that all vaccines are tested on animals, at this point in time, it is impossible to have a vaccine that has been created without animal use. It goes on to say, currently, COVID vaccinations are not mandatory, but this was written prior to the care home mandatory vaccinations coming in. At the very end, it says, we would like to make it clear the Vegan Society encourages vegans to look after their health and that of others. In order to continue to be effective advocates for veganism and other animals, it is responsible of each individual to make an informed decision about vaccines, bearing in mind the definition of veganism with support from their local healthcare team. So that's what the Vegan Society says.
Boyka's also put something in the chat here as well. Boyka, did you want to come in?
I have put a link to the British Society of Immunization Guide to Vaccinations for COVID. And there is a specific question there. Are there animal products in the vaccines for COVID? And the answer is no. The current COVID vaccines approved for use in the UK do not contain animal products. So all vegans and vegetarians need to be assured that by taking the vaccine, they do not introduce any animal products in their bodies.
Thank you, Boyka. Thank you. So ultimately, it is a decision, obviously, as a vegan, to decide whether or not you do take the vaccine. But there is a statement there about the need, and you need to make sure that you think about that as well. Was there anything anybody else wanted to say at all? No? Okay. Megan, shall we go on to the next question?
Yes, of course. So the next question is sort of a culmination of many questions that we've had that are quite similar, which is, what assurances can you provide me that the vaccine is safe, and can you confirm that the vaccine has been tested independently?
Would one of our GPs, Janine, would you like to talk to this? I know you did last time. It would be really helpful.
Yes, of course. I believe that the vaccine has been tested very well, and none of the actual testing requirements were skipped. Everything was done very quickly and in parallel, but we're completely assured that there was no steps, no omissions at all in checking for safety. And one of the things that assures me now is that the vaccines have now had, apart from, I think they had emergency approval in the United States, and now the vaccines have got full approval. And I mean, America is I mean, they really are very careful. There is a lot of litigation, there is a lot of legal process, and the fact that those vaccines have had full approval of the MHRA are for me very important, and do demonstrate that nothing has been, there's been no circumvention of anything in order for us to give the vaccine. I mean, the other thing is we've been yellow carding, which means that absolutely everything that's been happening has been fed back. So and all the patients, everybody has been asked to report every side effect, big or small, back, so that we've been really looking into this. And for example, we gave vaccines to pregnant people early on, and we've had very, very detailed forms that have been sent back to the health professionals, going through in detail everything that's happened to that pregnant woman and the outcome and so on. So it's been under great scrutiny. So many vaccines have been given already, and the information has been gathered. So again, that assures me.
Christine, you're muted.
Beg your pardon. Thank you, Janine. Thank you. Boyka, did you want to say anything at all?
Yeah, I agree with Janine. All the vaccines are fully tested, following very strict regulations and processes of safety. As Janine said, we are continuing to gather data and observe and monitor very carefully every dose given. And in the UK, we have given so far 91 million doses, 43 million people have been fully vaccinated, and this is additional sort of proof of safety, because it's been many months now. Side effects have been monitored. It is all vaccines that have been approved are very, very safe.
Thank you, Boyka. Thank you. Was there anybody else that wanted to come in, or shall we go to our next question? Is that okay? Megan, shall we go to our next question?
Yep, so the next question is the start of a string of questions around fertility and pregnancy. So this one is, I'm thinking about having a family. How does having the vaccine impact on my chances of pregnancy?
Again, over to, yeah, sorry, Janine, over to you or to Boyka, I guess.
Okay, we've looked at all the information that's come through the Royal College of Obstetrics and Gynecology and Fertility, and I've read them over and over again, and there is no known link at all to having the vaccine and fertility. There is no link, even theoretical, that they can think of as why you would not fall pregnant if having had the vaccine. So that's something we don't know where that came from. We think originally it came from because we were asking everybody, are you pregnant and are you planning to become pregnant in the next 3 months? And I think the reason was we would have to have extra conversations with people if they were pregnant or planning to become pregnant in order to guide them in with the vaccines. It wasn't because it was a warning that we shouldn't. Initially, we were not vaccinating pregnant people because there hadn't been any tests, but the tests have now occurred, and we've now had assurance that it is safe to vaccinate people who are pregnant, who are breastfeeding, and so on. But so that's one of the things. It also shows the vigorous science behind, because until they had the assurance, we waited, and then as soon as we were allowed to, then we were able to. As far as people who are planning to get pregnant, I would very, very much encourage them to have their vaccines now rather than before they're pregnant, because I always say to everyone, although we are assured that the vaccine is safe in pregnancy, given the option, it might be better to have any medication, any vaccine when you're not pregnant, if you're planning to become pregnant, because if you actually catch COVID while you're pregnant, the disease, it can be more serious, and also you may need to be receiving some medication to support you if you have COVID. And again, would you be comfortable to receive all sorts of medication, antivirals and all sorts of things that could be available while you are pregnant? Have they all been tested very well in pregnancy? I'm not sure. And we had a really sad story where there was a lady who was pregnant, and I think it's local, who then caught COVID and was really quite unwell. And they were trying to, and as she was getting worse and worse, I think they had to actually when you're very unwell with COVID, I don't know whether you've heard that you have to be treated on your front, and because she was pregnant, she wasn't able to be treated on her front prone position, and they ended up making a very difficult decision of delivering her baby prematurely at 28 weeks by cesarean section in order to be able to save the mother's life and be able to treat her properly. So I mean, these kinds of cases would really, if I was trying to planning a pregnancy, would make me want to have my vaccinations, because it's it's much more uncommon to end up in hospital and have a serious COVID if you've been double vaccinated.
Thank you, Janine. And I've noticed Suzanne very helpfully in the chat box, and I believe also Megan has put some information in here. So people can also ring to speak to a health advisor from the Healthy Child Programme, and the number is 0300 300 0123. And so if people want to talk about that, you can speak to a health advisor. There is also a live Q&A session that's being run by Norfolk and Waveney CCG, which is on the, let me just get the date for you, the 9th of September, 6 till 7 p.m. And we can give you the link to that as well. But I believe, Megan, that I believe it's on the CCG website as well. Is that correct?
Well, Boyk has popped the link in there now for us as well.
Indeed,
So
but if somebody's but if somebody's listening to the Q&A later and they can't access the chat, then it perhaps go and have a look on the CCG website. But there is, yeah, that's the time and that's the date. So there's some very helpful, supportive information as well.
We can put the link. Sorry, Christine, we can put the link for that in the video comments as well. So on our chat.
Excellent. Yeah, that's fantastic. Thank you very much. That's a very good idea, Megan. Thank you. Okay. And Suzanne also has put a fact sheet as well. Again, we can put that in the Q&A as well, which is about from the Royal College of Midwives, should I have the vaccine? There's some very, very helpful information at the moment, particularly around pregnancy and decision making around that. I think we've had discussions around this before, and I think some of the issues have come up because at the beginning, as Janine said, at the beginning of when the vaccine was rolled out, people didn't know as much about pregnancy and the vaccine, and they were asking questions about, you know, when they should have the vaccine. But as we've gone through this process, we're learning more and more, and we're getting more and more data, and we're getting more and more information about it. And I was speaking to one of the midwives at the James Paget Hospital, and she said, we're seeing an increase in pregnancy admissions, and when mums get ill, they often are very poorly and they need to be having the baby delivered early, which echoes what Janine has just said. This has an impact on the outcomes for the babies too. So I think it would be really worthwhile to, you know, to find out more information about that. Take up the advice, speak to people. You've got those contacts now, and you can go onto that live chat as well. So hopefully you'll get even more information as well. Boyka, did you want to say anything else? Oh, sorry, Janine, do come in.
I was going to say that a lot of people would know that during pregnancy you can develop gestational diabetes. If you're already diabetic, your diabetes would get worse. Your lung capacity is reduced during pregnancy sometimes because of especially later on in a pregnancy, and people do experience sort of like breathlessness and other issues as well. Your blood pressure can go up. So quite a lot of things of those conditions that we know make you more susceptible to COVID do happen in pregnancy in a physiological way. So I just wanted to add that as well.
Thank you, Janine. Thank you. Boyka, did you want to add anything else? You've been really helpful putting some fantastic data and information in the chat box there.
Just to add that already during clinical trials, when vaccines are tested, they compare a group of people who get the vaccine against the group of people who do not get the vaccine, and then see how the vaccine is protecting those who've been vaccinated. And already during these trials, some unplanned pregnancies occurred in both groups, the vaccinated and unvaccinated, and there was no difference in the rate of pregnancies that occurred. This means that the vaccine did not at all affect fertility. So this was clear already in the stage of the first clinical trials. And as Janine said, over the last a year or so, or 8 months, we have accumulated a lot more data with billions of people vaccinated around the world. So we know that they do not affect fertility, but as Janine said, pregnant women are at higher risk of severe illness, both for them and for the outcomes of the baby if they get coronavirus, and it is highly advisable that they get immunized.
Thank you very much, Boyka. That's really helpful. Megan, do we want to go on to the next question?
Yes, yeah, slightly been touched on, but I think important just to focus on. I've just found out I'm pregnant. Should I have the vaccine in early stages of pregnancy? And at what stage of pregnancy is it safe to have the vaccine?
Janine?
We haven't been advised not to vaccinate people in early pregnancy. So I think it's safe at all stages of pregnancy. But within the first 12 weeks is when the fetus is being is formed. From 12 weeks onwards, all the organs are formed and the baby's just growing. So if anybody's particularly concerned about anything, any medication or anything at all, that this isn't to do with this vaccine, but in general, if they are more concerned, if they want to wait, they can wait till 12 weeks. But that then puts back the date they will be fully covered. So I think on the balance of probabilities, I would have your vaccine as soon as possible so that you can be fully protected. If you wouldn't have the vaccine otherwise, then wait for 12 weeks.
Thank you.
But it's a kind of a personal opinion. This isn't a scientific advice at all. Thank you.
Yeah, thank you. And Suzanne, did you want to come in?
Well, only if it's just helpful to just mention here the advice from the Royal College of Midwives and Royal College of Obstetricians and Gynecologists that it says the vaccine doesn't contain any live virus, so it can't be passed to your baby through the placenta. It does say the antibodies you develop after having the vaccine can be passed through the placenta, so it's likely that your baby will have a greater protection against the virus when they are born. So that was the statement that they had made. But the virus, there's no live virus that can be passed through.
Thank you, Suzanne. And Boyka, did you want to say any more at all?
No, it is safe. The evidence is that it is safe at all stages of pregnancy, and it is protective. Yeah.
Thank you, Boyka. Thank you. Okay, Megan, shall we move on to the next question?
Yes, of course. I have high blood pressure. Does this give me a greater risk when having the vaccine during pregnancy?
The opposite is true. So if you have got high blood pressure, you're at higher risk of if you got COVID, and absolutely no increased risk from having the vaccine.
Thank you, Janine. That's very clear. Thank you.
And then there was one just quickly here that I think you've touched on already, Janine, but again, just for clarity, I thought best to ask. I have gestational diabetes. Does the vaccine increase my risk of any complications?
Same again, the opposite applies. If you've got gestational diabetes, you are at greater risk from catching COVID. Therefore, it is even more important that you have your vaccine.
Thank you. Thank you very much. Okay, Megan, shall we just go on to the next one?
Yeah, absolutely. I'm breastfeeding my baby. At what stage is it safe to have the vaccine?
there is no contraindications to receiving the vaccine while you are breastfeeding.
Thank you. Thank you. And did anybody else want to add to that at all? No? Okay, certainly midwives are encouraging the uptake of the vaccine. I know from my own personal experience and my granddaughter that it was looked at as being important to have the vaccine to protect yourself and your child. So yes, Janine.
I was going to say it was a question that we were asking. So again, that's probably why people are, because I think we do ask people if they are breastfeeding, and then we explain to them the evidence, because this is one of those things where just like, are you pregnant? We want to have that extra conversation with the mother.
Thank you. Thank you. Okay, Megan?
Yep, so the next one is, are there any reasons for people from different ethnic backgrounds for the vaccine, any different ethnic backgrounds to be excluded from having the vaccine? So I suppose the question is asking is it safe for everyone despite any kind of ethnic background?
Yeah. Again, Boyka or Janine, I know Kalu, you talked about this in the last session, but Boyka, do come in.
It is safe for all ethnic groups. It has been widely tested. Actually, some ethnic minority groups have had a worse impact of COVID. It may be because of, for example, higher prevalence of obesity among South Asian population groups, or other factors. But actually, the opposite is true, that we need to encourage high uptake of the vaccine among those groups in order for them to be protected from COVID.
Thank you. Kalu, did you want to come in, because you've done quite a bit of work with communities, haven't you, in Norfolk around the vaccination?
Yeah, I just want to say that, to echo what has been said, the vaccine is safe. It's meant for humans, irrespective of where you are coming from. And it is true sometimes that maybe based on your build or where your gene is coming from, maybe from minority ethnic group, there may be some vulnerability that is exposed to your life. But again, what we have found out is that it is better to have the vaccine and be protected irrespective of your ethnic background. So I would say that the vaccine is safe.
Thank you, Kalu. Thank you. And did anybody else want to come in at all? Be okay? Okay, Megan, do you want to go on to the next one?
Yeah, absolutely. So the next one is, please can you fully advise of all adverse reactions associated with the vaccine since its introduction?
Okay, I'm going to go to our clinical experts again, Boyka and Janine. I mean, I know we can read all about them in the green book and so on, but Janine.
There is a detailed patient leaflet with all the side effects and adverse effects listed in sort of order of common, uncommon, and rare. So it's not really easy for us to be able to say that. But the local reactions are very common, which are sort of redness, pain at the site, some feeling of sort of fever, flu-like symptoms are very common, and then the very rarer side effects have also been mentioned and listed. It's quite difficult with side effects because people will they will say how they feel after the vaccine, and some of it will be to do with the vaccine and some of it won't be. And even when you give some people sugar pills, they will say there are side effects because that day they may have a headache or that day they may have something. So but obviously all of this has been very carefully collected, so we do have a really good set of side effect profiles for the two different well, certainly I know for because we've given out a lot of AstraZeneca and a lot of Pfizer. I'm not as familiar with Moderna because they were given mostly in the pharmacists and the groups, but there is a really clear information leaflet that is available.
Can I just ask Janine where the information leaflet might be found? Is it in GP surgeries, or is it when you go to the vaccination sites? Where can people find it?
It is when you go to the vaccination sites, and then we give them out. But they should be available as a PDF. We could try and send somebody. I'm sure we could make available the leaflets if you wanted to include that.
That would be really helpful, Janine. Thank you. That would be great. Did anybody else want to say anything about that? I think Janine's covered it. It's very difficult to go through all the side effects, but that leaflet would be very useful. So thank you. Okay, Megan, the next one.
So next one's more of a statement, really, is about sort of mental health. Forcing people to have the vaccine can feel manipulative. For those who have experienced mental health issues and trauma, forcing them to have the vaccine can be harmful. So I suppose just weighing in on how we feel about that statement.
Yeah. And does anybody want to talk to that firstly? I mean, I'll start by saying this is one of the reasons we're having today, that this isn't about forcing people. It's about being able to make decisions on the basis of data and information and the best source of information possible. So it's about trying to find out what information you can trust and what information that you can make those decisions on. Ultimately, it will be your decision, but hopefully through conversations, we aren't trying to manipulate. We are literally just giving you as much data and background and experience as we can. So I don't know if anybody, Suzanne, you're typing, do come in.
Thanks, Christine. I've just literally just doing a link because I think it is recognised, that it's a genuine, concerns that people have and anxiety, and maybe it's coming at a time where there's lots of other things happening within their life. So it's not just about anxiety about the vaccine necessarily, but just want to have a bit more of a conversation about it, and to recognise, and obviously some people do have needle phobia as well, and there have been some great services actually across the county that are being put into place, which will allow people to be able to talk about it, to be able to have that conversation in a slightly different environment as well, and to help with where people might have needle phobia. I've put the there's a link in there which can take you through to a site where people can say that they are care home staff, and can also just talk about some of their fears and anxiety as well. And my understanding is that they will get a priority assessment, and be able to have that discussion with people. And there was also, and I know lots of people have been accessing this as well, with just kicked off with the worry bus as well, which again just enables a bit more of a discussion for people who might want to talk about it in it's maybe a different environment. And I'm sure Janine will also say for people to contact their GPs as well, again if they want to have a conversation with somebody who will know them, and know about any other conditions or particular issues that they want to talk through at the same time.
Thank you. Thank you very much, Suzanne. And just to say, yesterday I had a conversation with some people from NSFT, who Norfolk and Suffolk Foundation Trust, who have been working with people who have had needle phobia. And one of the cases that they were explaining to me about was a lady that came to them who was absolutely petrified about needles. But through quite lengthy conversations and through discussion, they actually were able to calm her and to talk to her. And in the end, she actually had the injection, and she said she didn't believe they'd given it to her. So with sensitive intervention, with support, people who have had really bad experience and terrible trauma around needles have been enabled to have the vaccine, and it's been quite remarkable what the people have been doing around needle phobia in the county. So again, there is support there. As Suzanne said, there is a link there to go to in the Wellbeing service. And again, I've put it in the chat box here. There's a free text that any care home staff with needle phobia can put in there, and you will be given a priority assessment and treatment, and you would go through as a priority. So again, lots of support for you, and it's something that has been recognised. And I know, Janine, we've talked about this in the past, where people have really got very, very anxious. They still want to work, they still want to have the vaccine, but they get so worried and so anxious about it. So they've done quite a bit of work across Norfolk and Waveney to support people. So hopefully that will be useful to you.
I was going to add, the James Paget Hospital had a special clinic for people with learning disability and autism, and we also, in all of the clinics, if you let people know ahead of time if you are anxious, that we make all sorts of allowances. People can sit and wait in their car until the last minute. They can come in with other people. They can be lying down, they can be while they have their vaccine in case they're worried about fainting. We have people with needle phobia in all the time, and as you say, a lot of them, once they've had the vaccine, say they didn't feel a thing. It's because it isn't particularly a painful vaccine to deliver, but we do make a lot of allowances. And as GPs, certainly been involved with quite a lot of people who've either had they haven't been able, we've sent people out on home visits so that they could have their vaccines in their own home if they are agoraphobic, if they can't leave their homes, and all sorts. So a lot of allowances will be made. The other thing about that sort of feeling of being sort of that impression of we're not forcing anyone to have the vaccine. It comes down to personal choice in the end, but there are many other things that people do for safety, or are in a sense may be imposed. For example, the wearing of seatbelts or the wearing of helmets and so on. Initially there were quite a few people who were a bit resistant to wearing a seatbelt and wanted exemptions and so on, because of the constraints. But I think it's one of those things where some of these things are for safety, for people's own good, for people's own safety. It's never forced, but we do certainly support people in those situations.
Thank you, Janine. Thank you. Okay, Megan, should we go on to the next one?
Yeah, absolutely. So the next one is, can you please advise me of the likely risk of fatality should I be unfortunate enough to contract COVID, and the likelihood of recovery? So that's more talking about contracting COVID itself.
Boyka, did you want to come in here? Because I know you've got some fantastic data and information, and we talk about this quite a bit, don't we, Boyka?
Yes. Well, the risk of death after contracting COVID depends on many factors, and some of them are, for example, age. And we know we're talking here about care home workers, because we know that residents of care homes are much more vulnerable because of their age. I will put a link here with a slide that lists statistics, mortality according to age. For example, among the over 80 plus, mortality from different studies is between 14 and 20%. It drops to about 8% in those 70 to 79, 60 to 69 years of age. It's about 3%, and so on. For younger people, the risk of death is much less. In over 20s, it's 0.2%. 2%, which means 2 in 1,000. So it is quite low. However, there are other risks apart from death. That is the worst outcome one can have. But there is a risk of long COVID, which means prolonged symptoms that persist over weeks and months, like, for example, headache or fatigue, which can be quite disabling, even in younger people. Apart from age, there are other factors that affect the risk of death, like, for example, obesity, diabetes, cardiovascular disease, and other underlying chronic conditions. So there is a variation, but generally, with age and chronic conditions, the risk increases of death. And also, one thing to add, it is not always possible to predict how a particular individual will be affected after contracting COVID. We've seen also hospitalizations and severe illness in younger age groups, in children and adolescents. So it is not an illness that can be ignored, and the risk is not negligible. It's actually quite severe. This is why we've had this massive impact on us over the last 1.5 years in terms of preventative measures, because it is quite a serious illness.
Thank you, Boyka. That's really helpful. Did anybody else want to say anything about that, or we should move on? Should we just move on? Okay, Megan, do you get the next question?
We're on our final question, actually, of our pre-submitted questions, and that is, please can you confirm that the vaccine you are advocating is not experimental mRNA gene-altering therapy?
I don't know. I'm going to go over to our GP and Boyka from Public Health, the doctors, Kalu as well. Anybody really that could come in and answer this? It's obviously a concern from someone.
It's certainly not gene altering, and that has been looked at again and again. There is the spike protein is created, and then it disappears, and it doesn't last very long in the body at all. So and there is absolutely no gene alteration following receiving the vaccine, and that it has been looked at for sure.
Thank you, Janine. Thank you. And this comes down to where we find information, doesn't it, Janine, and the sources of the information. So maybe somebody had found it somewhere and maybe hasn't been checked. So we've got, can mRNA? No, the mRNA delivered by the vaccine cannot enter the nucleus of the cells where your DNA is stored and will degrade naturally within hours. At no point is your DNA interfered with. Thank you, Boyka. And Boyka's helpfully put in the chat box the link there with the World in Data and Statistics and Research. So thank you. That's really helpful, Boyka. Thank you. So Megan, was that the last question? There were no other supplementary questions that were there?
No, that was the last of the prerequisite questions. It was something that was touched on before, and it's something that I know has come up before as well, but that I wanted to include, which was, can you please advise of the full list of contents of the ingredients, which I know might not be possible now, but it's mainly about, I think, the worry and concern that any of the ingredients are toxic to the body. So are there any ingredients in the vaccine that could be toxic to the body?
They're not toxic ingredients. I put a link earlier about this British Society of Immunology advice on the vaccine, and it lists the ingredient. There is an active ingredient in mRNA vaccines. This is part of the RNA, and the rest is water. There are no further substances that are harmful or toxic. there might be some additional substances to preserve the safety and the duration of the vaccine, that it can be stored and transported, but these are not harmful substances. There is no toxic substance in the vaccine.
Oh, Christine, you're muted.
Thank you, Boyka. Thank you. So, Kalu, you have your hand up.
Yeah, I think you touched on a few what I wanted to say, and Boyka has reiterated it. One of the things that we've been encouraging people is to be careful of their source of information. I know social media there've been a lot of things going on in the social media. I mean, for me, for example, we've always trusted people. We've always trusted our doctors, our GPs. We've always had trust on our community leaders and people who follow what is happening. It will always be good whenever one in doubt, go back to your GP and raise your concern. I am very sure that your GP will be able to support you and give you the guidance and from the right source. And rather than just going to the social media and reading what is there, because some of them are not really correct from the social media. Thank you.
Thank you. Thank you very much, Kalu. Thank you. So in terms of the questions that we've had submitted, we've gone through everything so far. So if people are on the call and if you've got any questions now that you'd like to ask and they haven't been covered, you can either pop them in the chat box or you can put your hand up or put your video on and just let us know that you want to talk and ask a question. So I'll leave it over to you for a few moments for you to have a think about. And if we've got any questions, we'll ask them to our experts. Please feel free if you want to come in and talk to us, though. It's absolutely fine. You can do so. So I don't know if everybody knows how to use the chat box. I'm sure most people do.
We have got some questions already.
Excellent. Oh, here we are. Yes, go for it.
What is the recognised notice period for non-vaccinated people, and how does this apply to people on maternity leave? So I think specifically about care homes and about the mandatory vaccination.
Yeah, so we've had this question before, so that if you are currently not vaccinated, you have until the 11th of November to be double vaccinated. However, if you're on maternity leave, it applies to when you return to work. So as long as you're double vaccinated by the time you return to work, whilst you're not working, there is nothing that can be done, but when you return to work, you must be double vaccinated. Suzanne, did you want to come in there? Or Stephen?
Yeah, sorry, Christine. I was pressing too many buttons at once.
Yeah.
So that there is operational guidance which I've just provided a link to, which is on the government website, which provides guidance related to practice, and I guess in general sense, all the employment practice is exactly the same as any employment practice that we would expect to see. So employment law hasn't changed. So I think it's important to just keep bringing it back to what you would normally do in terms of employment law around all of the vaccination. In terms of so notice period, again, it's probably one actually, I think, in terms of the government guidance, which talks about suggesting that notice periods are recognised. I think some of the employment guidance is potentially saying some of that can, because of the mandatory nature of it and people being able to deliver a service, there is some question about that. I think the government advice is still to apply the notice period. My understanding is that the notice period can be done ahead of the 11th of November, but the point that somebody would have their contract terminated would be can't be before the 11th of November, but that notice period could be exercised before that, is my understanding. Obviously, there are operational consequences to that in terms of whether people would be at work anyway. So I guess that's the thing that people would need to balance around that. But I think it's just making sure that we're still compliant with employment law as part of that, and the sort of practices that we'd normally go through in terms of informing people about policy and approach to it, making sure obviously we talk to people about the options as well, and as I say, giving people due notice about what is expected. And
oh, Suzanne's frozen.
Does that help?
You froze a bit there, Suzanne.
Yeah, but that's fine.
Thank
I think we got what you were saying. Yes. So I think this goes into, doesn't it? Do we give notice period from the 16th of September, and how will this work? Again, I think there is some guidance on this, and there is some HR advice on this. Certainly we'll be able to provide you with what we have. And Suzanne, I don't know, is there anything from Norfolk County Council? I mean, obviously we've got CPID stuff, and we've got I think we've got some stuff from the Care Association as well, haven't we, Megan, around HR guidance and so on. Is there anything else, Suzanne, that they need to be aware of?
No, I'm saying I think the only thing on the notice period is I think the government guidance is potentially slightly more erring towards the notice period than the CIPD guidance, actually, which I think is probably sort of taking a firmer approach on that. And say it would be for individuals to sort of make the judgment maybe around that. But I think there's some good guidance in. There's also in the government guidance, there's also lots and lots of links to material and other sites to help with that as well. So it is a good source of further information around it. I think the key thing is about informing people about your approach. That seems to be key, and obviously that can start now. And then in terms of my understanding against the notice period, it wouldn't be that the actual termination of the contract though could happen until the 11th of November. So I think that's the bit you need to keep in mind.
Thank you, Suzanne. Thank you. And then we've got, what is acceptable evidence of vaccination in both care and agency staffing guidelines for CQC? So in the guidance, it tells you what the evidence for the vaccinations are, that there's it says the app, the website, and a letter from GP. So it's actually identified in the guidance. So again, we can pop that in the information following this Q&A, but it is actually in the guidance. And I think the next one was, is this right? This one, representing a care home group. You mentioned that they are not being forced, staff are not being forced to have the vaccination. However, a lot of our staff are making allegations against us, saying we as their employer are forcing them. Any advice on how to manage this would be appreciated. Suzanne, did you want to come in there, or Palou, or anybody really? I mean, again, I will say just that in terms of your role, you have to advise them of the legislation and you have to advise them that that is what the government have put on the statute, and that you will do everything to support them if they wish to stay working in your care home to get a vaccine, but ultimately it will be their choice. Their choice, though, would mean that if they didn't have it, and it is government legislation, that they would no longer be able to work in the care home. I think the most important thing is that firstly is to just to give them as much information and explain this is legislation, and really it's out of your control. Suzanne.
Completely echo that, Christine. Just to say that we are raising this issue regionally and nationally. I think people are aware that there are some fairly standard grievance letters being issued right across the board, and say this is happening nationally as well. I mean, I think in terms of, I guess, scale of it, whilst it's broad, the reports I'm sort of hearing within Norfolk is it's probably not widespread in terms of absolute volume of those, but it's obviously in a very similar vein. We have asked whether there could be some better legal information issued from the government that could really support in managing that. But as Christine said, we need to follow the guidance and the legislation that we have in front of us. And that will be the expectation. That will be the expectation of CQC as well. So I think that's the main approach that we have to take. But it is also recognising that this is also happening, and it would be helpful to have some national support in terms of that legal line.
Thank you, Suzanne. And we have another question, and I'm very conscious of the time, so we may need to make this our last question unless anybody else puts in something now, or somebody is. Okay, so what are the exemptions on the vaccine? So the exemptions on the vaccine, again, are in the guidance, but it isn't. What we don't have at the moment is the guidance that's going to be given to GPs around exemptions. There's meant to be further guidance which has not been issued yet. So what we do know is that the exemptions are explained in the Green Book in Chapter 14A, and it talks about the exemptions there. There are exemptions for families and relatives, under 18s, people that people coming in to do emergency work, etc. But in terms of staff, the medical exemptions are in the Green Book. However, we are still waiting further guidance to be issued to GPs that clarify that even further, and also about process as well. It says that information is to follow, and we keep asking about this. And Janine, you haven't. I know you probably will be telling me you haven't received anything as yet, have you? No, exactly.
But there are very few reasons that I can think of where someone shouldn't have a vaccine, and many of those people actually probably wouldn't be in work, so they would be in the middle of chemotherapy or just about to start something, some sort of immunotherapy or something like that, which I would expect that because of their risks, health risks, they wouldn't be there. There is a particular condition called Guillain-Barré syndrome, where then those individuals may be advised not to have a vaccine if it was after a previous vaccine and so on. But it's very, very uncommon.
Yeah,
and we're waiting for guidance.
Yes, exactly. So if you need to look at it, go back to the guidance that's been issued, and there is a link, and it takes you to the Green Book and Chapter 14A, and it lists, and there's quite a comprehensive list, but they are very specific conditions, and as Janine says, they are quite exceptional exemptions. So we are still waiting for GPs to be given further guidance. So, Suzanne, you're typing, and I yeah, did you want to come in as well?
Well, it was only just to just do the full list of anything in addition to medical
Yes.
exemptions. I can very quickly run through them. It's
Yeah.
people working entirely in the grounds and not entering
Yeah.
the premises.
Yeah.
Residents, a friend or relative visiting a resident, a person visiting a resident who is dying or to support a resident following a bereavement, those who provide emergency assistance, emergency services or emergency maintenance, and under 18s.
Yeah, and the rest of the medical exemption is the thing that people keep asking about, and all we have at the moment is what's in the Green Book. We haven't heard anything that is going to change from that, but that's what we know. Okay. Well, thank you very much. Unless there's any other questions, I think we will end there. But if people after this meeting do think of some other questions that they wanted to ask us, please send them to info@norfolk and Suffolk Care Support.co.uk. Again, we can make that available so that you know where to go, but presumably you've got that because you're here today and that's where the link was. And we'll pick them up and we'll distribute them around to the experts for them to answer as well.